Hi, everyone. Thank you so much for joining us. Today we have Carlos Estevens here again, and we want to make sure that we address your questions. We want to make sure that we're answering everyone's questions and everyone is getting the reassurance that it's needed. ¿Cómo estás, Carlos?
Bien, muchas gracias. Thank you so much again, and thank you for your question that is very valuable in order to know more about Duchenne muscular dystrophy.
Yes. So I want to go into the first question. So the first question that we have here is, how do I find clinical trials for my son? How do I find a good team of Duchenne doctors? How do I get a school? Oh, sorry. The first question is,
You raised all questions.
yes, so sorry.
No, yes, related to the first question, it's important to mention that in the case of the Duchenne muscular dystrophy, are many trials now ongoing in different aspects of the mechanism of action of the disease. For the reason, in order to cover everything, I think that maybe a good source of information will be clinicaltrials.gov. Then the caregiver or the patient can enter in this website, then can search about Duchenne muscular dystrophy, and then appear all of the clinical related to this. And then the coordination between the primary care physician and the neuromuscular specialist, plus the investigation site, will be a good connection in order to see if the patient is eligible or not to go for the specific clinical trial.
Perfect. Thank you. How do I find a good team of doctors?
Well, as discussed in the beginning of the interview, it's so important to continue and also to develop a close multidisciplinary team. Remember that this kind of disease is a multisystemic disease. The most affected is the skeletal muscles and the heart. However, it's important the coordination between many specialties. It's important that your primary physician, that maybe will be the family doctor or the pediatrician, have a close connection with the neurologist or neuromuscular specialist. Usually, the neuromuscular specialists lead the group of persons of the multidisciplinary team. Then you need another kind of specialist like the cardiologist, pulmonologist, all of the rehabilitation staff, that is the physical therapist, occupational therapist, speech therapist, and also the importance of the mental health. With this coordination between all of the team, you can have a good management of the care. Also, you have an interesting source of information. Then you can enter and you can see what is the center of excellence or center of care for this specifically disease. And then out of USA, also you have another sources that maybe you can enter in the Latin America and Europe, and then you can enter the information and you can see what is the best specialty centers. But in some occasions, maybe you need to get in different centers to go for the different specialists. Then the importance to have a care coordinator with you in order to support this kind of connections between the institutions, and then you have a good multidisciplinary team in the care of your son.
Thank you. Thank you for that. So the next question, how do I get my school on board with my son's need as he looks normal?
Well, that is a very good question because one thing is when he's in home and everything is according to their needs, and also the caregivers and the siblings know about how we can manage well all the situation related to the disease. But in another times, it's really hard that the other people maybe see that something happened with the kids. For the reason, I think that the first point or the first step is to have and educate the teachers, educate the personal aid that is in support the kids, and also maybe the nurse or medical staff in the school. That means that it is important, in addition to the educate about the disease, also important to have an open communication between all of the staff. Here in USA is a big advantage that you have a special plan, that is the IEP, and then you can discuss all of the needs, what is the metrics, goals, objectives in the development of each kid according to their needs, according to the school agenda, and according to the physical agenda, and then you can ask him for many kind of special services. That is the case of the physical therapist, occupational therapist, speech therapist, and this coordination between all of the staff inside the school, as the same as the clinical hospital, is a multidisciplinary team in charge for the kid, also help in order to improve. Then also it's important to assess the needs of the different accommodations, because maybe depending on the stage of the disease, when you have a non-ambulatory stage, maybe you need more support, and how is the transportation in a wheelchair. How maybe you need a nurse or a personal aid that's supporting during the ground transportation to go to the school. And then in the school also, how is the connection between the nurse of the school, of the maybe an special aid or a special nurse for the kids. If we have another kind of a stage of the disease or maybe more severe disease, also what is the coordination between the potential medical equipment that they need and also the medication that maybe you need during the school hours. It's important that all of the team and also the classmates will be inclusive for the kids with Duchenne muscular dystrophy. If we're talking about the physical activity, it's important to adapt the exercise according to the needs. The aerobic exercises are so important. And then you have a different kind of very good source of information again that you can enter, especially for the patient advocacy groups, that they are developed rich materials for teachers, for caregivers, in order to support this kind of communication or discussion about the needs of the kids with Duchenne muscular dystrophy.
Perfect. Thank you so much for that. So, on to the next question. This is a very good one. Does my son need to have a biopsy to get diagnosed, or there are other ways?
Well, now in the new era of the genomic test, the biopsy is in case that you don't have you have the suspicion of diagnosis, but maybe are not contundent the final results of the other tests. We
Mhm.
start first with the clinical part of the disease. If you remember, we discussed about the early signs and symptoms. For example, abnormal gait, calf hypertrophy, inability to jump, many falls. Also, it's difficult to walk. We have the different kind of steps. For example, to walking, difficulty in running, and also maybe you can see behavioral issues. This is the first part of the clinical. And I like, for example, the mnemonic that used the Neuromuscular Disease Center in Newcastle in UK. That is the mnemonic muscle. That is motor milestone delay, unusual gait, speech delay, leads to CK ASAP, that is one of the tests, leads to early diagnosis of DMD. That is the muscle. And then when you have this clinical suspicious and also you have a familiar history of the disease, maybe it's important to conduct the genetic testing in order to confirm the diagnosis. But sometimes if you have the clinical history and you have the genetic testing, but it's not contundent results in the genetic testing, maybe you need to go for the biopsy. The biopsy is an invasive procedure that you take one sample of the muscle and then you can see if you have the correct level of the dystrophin, that is the protein. You have a low levels, or maybe you don't have the production of the protein, also is a positive diagnosis of the disease of Duchenne muscular dystrophy. Now it's less used, but all depends of the other test that is available.
Perfect. Thank you. So, on to the last question. ¿Qué por ciento de la población sufre con esta enfermedad?
Well, that is a nice question. That is, what is the percentage of population that maybe suffer of the disease? Well, as
Mhm.
mentioned before, that is a rare disorder. That means that there is a low prevalence with compared with the common diseases. It's described in general terms. There is around 1 in 3,500 male births that is affected for the disease, but it maybe is another population that is less, that is affected maybe 1 in 2,300, that is a less in the prevalence. If we're talking about USA, it's calculated according to the prevalence is around 10,000 boys affected with the disease. And this differs country by country, especially we have a good epidemiological studies, but that is the, in general terms, that the population that suffer for this kind of condition, Duchenne muscular dystrophy.
Perfect. Thank you so much for being here today with us and answering these questions. It is super beneficial that we provide this to the community. Is there anything else that you want to say that to the community before we go that you may think that it would help them in the transition of getting their children either diagnosed or the support that they need?
Yes, I think that is this kind of conversations are so important because it is uh, we have the importance to get the awareness of the disease. If we're talking more about this kind of condition that is a rare disorders, also the people and the physicians maybe get more knowledge about the disease. And then that means that also in the next patient, or in your home, or maybe the teacher with a specific kid, if they see this kind of red flag symptoms, they can go for the early diagnosis. As I repeat many times during the conversation related to the early diagnosis is early treatment, better management of care, and then better outcomes. And again, thank you so much for this communication, and also because this will be in the Facebook. Also, maybe we can follow up, or if we have any questions in the future.
Yes, if you have any questions, please put them in the chat and we'll make sure that we get back to you and we provide the resources needed if we're able to. Thank you, everyone. Enjoy your weekend.
Thank you so much.
Thank you.